In the United States, there has been a lack of patient engagement, and as a result, many preventable deaths were not avoided. Improving such behaviors like exercise, keeping up with medical appointments, blood sugar regulations, and such things can impact and improve a patient's life. With the use of information technology, patients can improve their unhealthy behaviors since they can be more engaged in managing their own health. With the use of social media and other online tools, some patients have become more engaged and proactive in changing their unhealthy behaviors. Information technology generally has very high potential benefits. However, there has been no clear results about the effectiveness of information technology platforms on patient engagement and behavioral change.
In the research done, various electronic technologies such as Google Scholar and PubMed were assessed to find the impact that the chosen articles had on patient engagement and the impact that they had on health behavior and the outcomes of that. Related articles were included if they met the criteria that the research team had proposed, which included articles about IT and patient engagement and health behavior, disease management, and any clinician-focused articles. I think that the quality assessment done for each article chosen was necessary because there are several articles that can be found on Google Scholar and they may not be the most credible or the most reliable. The data extraction process included assessing the study details, the study characteristics, interventions, and outcomes. The outcomes were then further assessed as positive impact, in which this meant there was an improvement in care, or no impact or no noticeable change. I think that the study did well in assessing impacts of IT. However, I don't think it accounts for those who don't have access to electronic technologies. I think in order to find the true impact and the true significance of these electronic technologies and the impact, I think that there needs to be a similar study done, but the focus is on pamphlets, workshops, and people who directly speak to healthcare providers. I think that finding the differences in the impacts between both of these will either highlight or downplay the actual significance of electronic technologies.
After a total of 170 articles met the inclusion criteria and were reviewed, only 40% referenced specific behavior theories and only 35.5% assessed the usability of IT platforms. The majority for the study used indirect ways to measure health outcomes. In conclusion, the review showed that the IT platforms can enhance patient engagement and improve health outcomes. Further research is needed, though, to clarify any ambiguities, and additionally, any assessment of these types of interventions should be conducted based on common framework using a large variety of measurements such as motivation for health, behavior change, long-standing adherence, expenditure, satisfaction, and health outcomes.
UCI biomedical engineers have developed a wearable respiration monitor to help children with asthma, cystic fibrosis, and other chronic pulmonary conditions. They created these sensors by applying a very thin layer of metal to shrinky dinks, which shrink with heat and become corrugated. It is then transformed to a soft, stretchy material that can be adhered to a patient. It is placed beneath the 9th and 10th ribs, and another is placed on the abdomen. The device tracks the rate and volume of the wearer's respiration. The details from the sensors are able to be transmitted via Bluetooth to display on a smartphone app. Michael Chu, a UCI graduate researcher in biomedical engineering, says that standard respiration monitoring consists of a pulmonary function test that is difficult to perform. However, this monitor allows users to function and do daily tasks while vital information is being collected. It is important that this new technology has features that allow users to live their everyday life without much, if any, adjustments at all. It also appears to be simple to use even for children. The only concern I would have for this article is how successful this monitor has proven to be. Perhaps there still needs to be further research, but so far it seems like a great step to making the lives of those with pulmonary conditions easier.